Chapter 33, Skin Integrity and Wound Care. Structures of the skin. So we have our epidermis, which is our waterproof protective layer of keratin. There are no blood vessels in this layer. Regenerates easily and quickly. Then we have our dermis, elastic tissue made primary of collagen. And in this layer, we have our nerve, our hair follicles, glands, immune cells, as well as blood vessels. Under the dermis is the subcutaneous level. And this anchors the skin layers, the above skin layers, to the underlying tissue. So subcutaneous level is where our adipose or fat tissue is. So the previous slide on page 1149, it talks about all the different layers of the skin, but we talked about that in lab when we spoke about the staging of wounds and what stage was damaged in relation to wound staging. And for those who have HBHD, we talked about skin recently. All right. So for this slide, the functions of the skin, you want to know all the functions of the skin, and it begins on page 1149 at the very bottom, and then it goes over into page 1152. Table 33-1 is a nice chart. It has the functions of the skin, and then it talks about the mechanisms of the skin. I have special attention to protection. So acts as a barrier for water, microorganisms, and damaging sun rays or ultraviolet rays, protects against infection, protects against injury, underlying tissue and organs, prevents loss of moisture from the surface of the underlying structures. Okay, know all the functions of the skin. Okay, so we have a question. Blood vessels in the skin dilate to dissipate heat, true or false? And the answer is true. So one of the functions of the skin is regulation of temperature, and it describes that in our table 33-1, dissipates heat as blood vessels in the skin dilate. Answer is true. So familiarize yourself with this picture, this cross-section of skin. In addition to, we have our hair, and that's our hair shaft that's exposed outside of the skin. You want to know that. You have your layers of your epidermis, your dermis, and then your subcutaneous level. And in that dermis, you have all of those nerve endings and blood vessels. So you want to make a note of this picture in case you see a picture on your exam. So always make it a point to know the factors that affect the topic that we're studying. So this is on page 1152. So factors affecting the skin. So we have 4 bullets here. Unbroken or healthy skin, mucous membranes defend against harmful agents, resistance to injury is affected by age, amount of underlying tissue, and illness. Adequately nourished or hydrated body cells are resistant to injury. Adequate circulation is necessary to maintain cell life. And then on page 1152 also talks about developmental considerations as well as the patient's state of health, which is some of the things that we mentioned here. On our next slide, it looks like we'll talk more about the developmental considerations. So developmental considerations begins on page 1152 at the bottom. In children younger than 2 years old, the skin is thinner and weaker than that of adults. In infant skin, the mucous membranes are easily injured and subject to infection. A child's skin becomes increasingly resistant to injury and infection. The structures of the skin changes in a person with age. So the maturation of the epidermal cells is prolonged, leading to thin, easily damaged skin. So that cellular reproduction is prolonged. Older adults circulation and collagen formation are impaired, leading to decreased elasticity and increased risk of tissue damage from pressure. Causes of alterations in the skin. On page 1153, table 33-2, we have factors placing a patient at risk for skin alterations. So you have your factors on one side and you have your nursing implications or interventions on the other side. So I would definitely read through this chart and know that, right? You want to know about any problems and how you as a nurse can treat that particular issue. All right, causes of skin alteration. Very thin and very obese people are more susceptible to skin injury. A patient who lost fluid due to an illness such as a dehydrated patient is predisposed to potential skin breakdown. Someone who has jaundice, their skin may be of a yellow tint. It may actually also be itchy, causing them to scratch it, predisposed to potential skin breakdown as well. A person with a skin disease such as eczema or psoriasis may have lesions that require special care. They may also be itchy and scratchy and cause skin disease as well. I'm sorry, alterations in skin integrity.